So our case over here, 32-year-old male patient with history of heart failure and AFib. He was admitted to the hospital with progressive shortness of breath, syncope, weakness, diaphoresis. He's been suffering with progressive dyspnea for the last 5 years. It seems that his blood pressure is low and he has pulsus alternans, bilateral crackles, and elevated JVP. Pulsus alternans means that the pulse strength is different between every other beat. So let's look at the parasternal long axis view. We can see the left ventricle, left atrium, and the aortic valve and the ascending aorta. As you can appreciate in this image, the left ventricle is not squeezing at all, is hardly moving. Let's go to the short axis view. Same thing, you can see that the left ventricle is dilated. Also, the right ventricle is dilated. This might give you an impression that the pressure in the right ventricle is also high. Let's go to the apical chamber view. And then we'll have to change the depth so that we'll be able to look at the atria. All right, the left ventricle is here, right ventricle is here, LA and RA. And as you can appreciate, the left ventricle is not moving at all, it's hardly moving. And it's not just one area, it looks like all the ventricle is really not moving. Let's go to the subcostal. Okay, and in the subcostal view, RV, LV, RA, LA, same thing, hardly moving. Let's look at the IVC. And this is the right atrium, this is the IVC. The IVC is more than 2 centimeters, so it's dilated and it's not collapsing. So this tells you that the right atrial pressure is high. All in all, looking at this case, 32-year-old with history of heart failure and atrial fibrillation, comes in with progressive shortness of breath. His ventricle looks like it's not pumping at all. So this is one sign that the patient is in heart failure. 2, right ventricle pressures, right atrial pressures are high. IVC is dilated, so that tells you that there's fluid overload, and that fluid overload has led to pressure overload. And this all will tell you that the patient is in acute on chronic congestive heart failure.